Alright, so today we're going to talk about how to enroll somebody in Obamacare. So we're at healthcare.gov, and this is where it all begins. So the first thing I like to do is go to See Plans. So it's healthcare.gov/C-plans, and this way you can go ahead and run a quote for your clients right away. So let's go ahead and do for instance, let's do 32750, and this will bring up an estimator. Again, this is just a disclaimer to tell your clients that it's an estimation on what you're going to show them here. So go ahead and read that for them. Next step is household income. So what is your client's household income? This is what they're going to claim on their taxes for the household. So if they're husband and wife, you're going to include both the husband and the wife's estimated household income for 2015 in this case, but every year you're going to have that household income that they have to submit to the federal government. So this one here, let's say for instance, is $12,000, and a single person. Let's say their age 33. Non-tobacco user, not a parent, they're not pregnant, and they do not have insurance. Let's say that person is married, let's say 31, and same thing here. We go ahead and hit add, and then we'll go ahead and click, well, just in this case what we're going to do is just going to say a single person here, and we'll go done with this step. And so the next part is it's going to show you what their estimated eligibility results are. So this is going to be the household income is eligible for $269.06 per month for their premium tax credits. Okay, so this is the amount the federal government is willing to give that person per month towards their health insurance. Okay, the second disclaimer you're going to see here, it says this household may also be eligible for cost-sharing reductions that reduce what you pay for deductibles, co-payments, and co-insurances. So this person is going to be best off with the silver level plans because it's going to reduce not only their premium but also their deductibles, co-payments, and co-insurances. Here in Florida, that's the only level of plan that's going to do the most for that person. So basically what I do is to begin the quote, I go ahead and go through to the plans, and then of course you've got your regular disclaimer here that says here's the 4 things to know about your marketplace health plans. Essential benefits, we talk about what the new law entails. All plans cover doctor visits, prescription drugs, hospitalization, maternity and newborn care, and preventive care services. Dental and vision are usually separate, so you'll talk to them about that. Again, we talk about the 4 categories of plans, which is bronze, silver, gold, and platinum. Bronze level covers 60% of the total average cost of care. Silver at 70%, and you just keep an eye on this number here because we're about to see something crazy. Gold level at 80, and platinum level at 90. Okay? So the way I explain it to my clients is we've got, again, the higher you pay in your premium, the lower your out-of-pocket costs when you go to use the plan, and vice versa. Very much like a seesaw. Okay? We're in a special enrollment period right now. For this year, it ended on February 15th. But again, we're going to have different times of the year where they can enroll. So if you do have an SEP, just make sure you let them know. All right, so this is Seminole County here, and you'll see the first plans is going to start from the very least amount of premium at 0. But again, we're looking at bronze levels. So what you can do on the left-hand side is you can start organizing by premium, organizing by category, which we're going to select the silver plan. If a person is looking for PPO, you can just get the PPO and get everything else out of the way. Or if they know they really like, for instance, they like United, you can select only the United plans to take a look at. There are medical management programs as well, so if you're looking for those types of programs, they're in there also. So in this example, we know that that person qualifies for silver level, so we're going to go ahead and click silver level plans. There are 27 in Seminole County. On the top right, it's going to show the estimated tax credit, which is $269. So we sorted by monthly premium, or you can go by deductible. So it flips it around on the health plans. After I explain deductibles, a lot of people get really very interested in plans without the deductibles, so that might be something that they're looking at. You can also flip it to dental plans too. So for instance, if you're looking for dental plans, again by deductible, Delta would be the least expensive. So let's talk about major medical, and we'll go ahead and go by the monthly premium here. So least expensive on the marketplace bounces back to bronze, so we got to go back and click silver. Here's our 27 plans. Humana's the winner here. Estimated monthly plan premium would be $1. It would have been $270, but with the $269 tax credit, brings the estimated monthly premium to $1. Deductible is $500. Max out of pocket is $750. Primary care is $25. Special is $35. Emergency room care, they'd have to meet their deductible in here, and then Humana pays 20% or 80%. The member pays 20% only up until they pay the $750. Okay, and then you got generic medications that start from there. You can go more into detail with the summary benefits, plan brochures, provider directories, and you can even check prescriptions here. And then you also can go into the plan in more detail. We're going to do that in a minute. The other plan I like to show people is this United Healthcare Compass plan. This would have been $313 because of monthly plan premium tax credit of the $269 brings the United Compass plan to $44. Okay, so because of that, zero deductible, max out of pocket $400. Fantastic offer for this year. Primary care 20, specialist 40, emergency room 10% after deductible. We look here, there's no deductible, so immediately United pays 90%, the member pays 10%. Only up until they pay $400, then they're done for the year. Now, they still have to pay the premium, so they must continue to pay the $44 premium. Generic medications are $10. Summary benefits, let's take a look at what that looks like. Typically pops up a new window here, and then you're going to select, here in Florida it's called the Compass plans, so you can go ahead and go through the Compass products, and this just talks about what's going on here. And since we're at the Silver Compass 4000, this will actually pull up the PDF. Here you can go through the summary of benefits as well. This will give you the standard deductibles. Remember, those are adjustable when a person qualifies for extra help, so don't go by these numbers as far as the deductibles and that sort of thing. But the copays will always stay the same. So these copays, you can go through the plan here. You got your summary of benefits. So that's really nice to have. Close that out. You can also look for doctors and formulary. So very easy there. Let's say you wanted to dive a little bit deeper without going into the summary benefits. This gives you a nice overlay of what the plan looks like. Again, it covers everything from prescriptions, so it talks about brand names, access to doctors. Again, you can check the doctor list. Hospital service, dental service, that kind of thing. Okay, so at the end of the day, let's say this person says, yeah, this is a winner, I like it, I pay $44 a month, I have no deductible in case something happens, and I know worst case scenario, I'm only going to have to pay $400 a year. So let's take the next step. So if the person already has an account, you'll go ahead and sign in here. If they do not, you're going to have to create an account. Okay? So let's go ahead and pretend this is worst case scenario here. You've got to create an account. You're going to ask for which state you're in. And click Florida here. Type in the zip code again, 32750. and that's Seminole County. Again, we're in a special election, so you can find out, but most of the times you're going to realize whether or not they can change. But let's say you already know and you're ready to go. So we go ahead and click continue. Now they're going to ask you for that person's info. So let's go ahead and put in my info here. So let's go to, okay. Alright, and I don't want to receive any of that info, so and then you can create a password. I usually do something that's standardized, so whatever you want to do for your clients you can. I'm going to create a password here. Alright, and then it's going to ask you for some security questions. So, you got things like favorite cuisine. That one's not always so great because a lot of people say pizza. Seems to be pretty popular. What city your mother was born. Again, just plug and play. And let's say favorite childhood friend. Yes, I had a favorite childhood friend with my same name, so we'll see that. Okay, so we're going to go ahead and hit create an account. Alright, so if you're using the same computer, it's going to send me an email, right? So you can go to your AOL email, it'll take you to the website. I've already got my email open, so we're going to go over here. Here's my account, it's created. Now this is very important because if that person doesn't have access to their email, they have to click this link in order for you to get into their account. So if they don't have their email on either their phone or if they're not in front of their computer, it's going to be very hard for you to continue. So they have to get this email. A lot of times it goes into the spam folder, so you're going to want to check that too. But it'll come from the Health Insurance Marketplace. It'll say Marketplace account created. Go ahead and click in there. Okay, and you'll see the success button. So you're ready to go. Now one technique is you can go ahead and collect all the information ahead of time and call into the marketplace with the client and become an authorized representative. This will allow you to go ahead and do the application by yourself, and you can take as much time as you need to get it done. I'm going to show you the long way to do this because I want to show you all the moving and missing pieces here as we go through this. Okay? So username again is the person's email address. Password is the one we created for them. And we should be good to go. Okay, and we're in. So the first thing you'll see is the terms and conditions. Make sure they read that, or you can read it to them. They're going to have to accept it. And now they're asking me, Justin, where would you like to go? So I know that I need to create an account from scratch. So let's say we go in here. Okay, we're going to go through Florida here. Next. And here we go. So there's a disclaimer here because the open enrollment period is over. So if you have an SEP, don't worry, just continue as normal. Here's some things that you're going to need from them. Again, at our office, we have our check-in sheet, so that has, all the information you're going to need to do the application, so you can fill that out ahead of time and then jump in here and do it, when you need to. So. So here we go. It's going to ask me for some information here. There's my name. Okay. Phone number. Okay. Now I'm going to pause this and come through here because I don't want you guys to know all my date of birth and social. Not that I don't trust anybody, but better safe than sorry. I don't mind if you know where I live. You can come visit anytime. 2750. And then, of course, we'll go ahead and do our social and date of birth that way. As soon as you plug in that information, it's going to ask you for some identity questions. So we went through here, and now we have the identity questions here. It says you opened a mortgage. Alright, so you just select the correct answers here as we go through this. So you verify the identity here, and it should go ahead and pull up all your records. So it says my identity has been verified. We are good to go. So we're going to go ahead and agree on that, and now we begin the application again. So let's go ahead and do this. So again, we pick the let's go ahead, well, I'm doing this for myself. So this is a married couple here. We have no tax dependents such as children. We're applying for me and my spouse, and let's say for instance we're under 66,000, and we'd like to see if we can qualify for extra help. Okay, so does everyone have the same address? Yes. We'll be filing together? Yes. We are not responsible for any children. No one's a full-time student, and no one is pregnant. Okay. U.S. citizens? Yes. Social Security's yes. Are we applying under a different name? No. We're not naturalized citizens. We're not in jail, and we're not in Alaska, which is the same thing. And I'm just kidding. And then you've got, you know, we don't have other options here, and no foster children. Okay, so those are just some questions there. All right. So again, it's going to go through household contact information. You know, what kind of phone number? It's a cell phone. You can change it. I prefer English, but they got all sorts of fun stuff in there for both written and spoken languages. You can go paperless. Now, this is the million-dollar question here. Very small. It's asking, is there another person helping you with your application? And as a broker, you want to make sure, whoops, that you put, I don't think I have my R in there, that you are an agent. You can put health plan markets there. Whoops. Okay, ID number is not necessary, but your NPN is very crucial. Okay, so make sure you put in your NPN. If you don't, you can use mine. I'll be glad to take credit for it. No, I'm kidding. Always make sure you put your NPN number in the application here. Okay. Okay, so once you put in all the information about the job, you're going to ask some additional questions. They're asking if anyone has any physical disabilities, anyone needs help with daily activities, or anyone needs help paying their medical bills from the last 3 months. So if none of those people are there, now one thing you might want to do is go ahead and jot down the application ID, because we're going to need that. This is really great to have. So we're going to go ahead and click continue. And it's asking here, are we currently enrolled in health insurance? Let's say yes here. And for instance, let's say that you do have coverage already. So maybe it's through your job. You put your coverage name. Policy number is not necessary. I usually put, because most people don't know it. If you got it, go ahead and put it in. That's great. So that's what you can do. If they have Medicaid or they lost Medicaid, you know, you can go ahead and put that info there. So let's say, for instance, everyone does not have health insurance. Were any of these people not eligible for Medicaid? We're going to click that. Let's see here. Okay. Life changes. So this is basically how they're figuring out whether or not you have an open enrollment period. Okay. So the first question is did anyone lose health coverage on or after April 28th? Okay. So they're going back 60 days, because that's the SEP. Does anybody have a 60-day SEP here? And if we say no, we go to the next one. Is anyone going to lose coverage before August 26th? So we're looking for if they are going to be losing coverage in the next 60 days. Let's say, for instance, both people are. There's your SEP. Anyone get married? Anyone got released from incarceration? Anyone gained eligible immigration status? Adopted, placed for adoption or foster care? And then, of course, moved, which is a pretty popular one. We've got a lot of people that move, you know. So let's say, for instance, that we are going to lose coverage on July 1st. Just as an example here, July 1st. Whoops. Okay, so there's our SEP. We agree here, and then it's going to ask us to review the coverage. All right, so there's your application summary, and you're going to go through all the information. You're going to scroll down at the bottom here. We already went through everything here. Do you agree with all of these statements here? Go ahead and read them. And then, of course, under the penalty of perjury, you agree that everything is correct, true, and right. So we go ahead and sign the application, and you are complete. Go ahead and submit that app. And what's going to happen is this goes up to Social Security, and they determine, and then over to IRS, and they determine what your tax credit is for sure. And then we're going to get a readout here in about 5 seconds. Okay, maybe longer. All right, so here it is. Drum roll. All right, so you're going to see here the eligibility status. They're going to ask you for your application ID. There it is there. The date that you submitted your application, which is today's date. And right off the bat, you've got your eligibility results and then continue to enrollment. I'm going to come back to that in a moment. If anybody qualifies for Medicaid or you want to send that information, you're just going to go ahead and click send to Medicaid. If not, you don't have to press anything here. And then once you're ready to do that, you can have somebody register to vote if you want to. I don't usually waste my time with that. But you'll pick up this here, and this is your PDF of the results, okay? So it'll pull up the PDF of the letter that they're going to send to the person's home with the application ID number, the date it was submitted. So you actually see what they're going to get in the mail. This is exactly what they're going to get in the mail. Alright, so we're looking for eligibility for special enrollment period. There it is there. And then the tax credits. There it is there. In this example, we went ahead and put $285. Again, this is all adjustable because people do change, you know, incomes and all that. So the $285 tax credit is eligible there. So we're going to close that. And then we go ahead and click Continue to Enrollment. Okay? So in this example, we're going to go ahead and go through the tax credit usage. So we go in here, click Continue. And this is where I explain what the tax credit is all about. So you've got, remember they have options of using their tax credit. They can use all of it, they can use some of it, or they can use none of it at all. So these are all questions that I go through with my clients just to make sure that they understand how this works. So you click I have already reviewed, and then just a final confirmation, are you sure you want to use all of your premium tax credit? We say yes. And then we confirm one last time. And there you go. This also is going to ask you whether or not anyone is a tobacco user. None of us are, so you go ahead and click there. Again, if they are, it's going to rate them up 1.5% on their, or they're going to pay premium and a half on whatever it is. So that's one group. You know, husband and wife is one group. And then now is the fun part, choosing a health plan. So we decided that we wanted to do the United Healthcare. Alright, again, those are those examples here. Go ahead and click there. And again, it's going to pop up, you know, what the prices are going to be looking like for husband and wife. You got bronze level, silver, gold, and platinum. We've got the silver levels here. New selection. In the first example, we were talking about a single person. In this one, we did husband and wife. But same principles here. You'll see how the tax credit is used. So this is the was $531 with the tax credit. It's going to be $246.41. You see the deductible and the maximum out of pocket here. Same ideas. You can go a little bit deeper into the plan. All right. And then you just scroll through. You pick which one that the client likes, and you simply click enroll. Okay, so we go ahead and click enroll. It's going to give you an effective date. It's looking for August 1st, most likely. So you click confirm. Okay. Dental plan. Go ahead and you can pick a dental plan if you want to. It's the same exact procedure. Click the people that are looking for the dental plan. If you don't want the dental plan, you can skip this part. It allows you to go right past it. It's not a big deal. But if you do decide to choose a dental plan, you have to choose that you want to look for one. So again, another button pops up here, and you go shopping for your dental. So you pick whichever one you want. Say for instance we wanted to go with Humana PPO. Go ahead and click enroll. And here you are. You're at the end of it. So I mean, this took about half an hour or so to get done. Again, you don't have to do it all at once. You can do it collecting the information, all the pertinent information that we have on our forms. Grab all their info, and then make yourself a representative to call into the marketplace, and you'll be able to enroll them by yourself and then call them back when they're ready to go. So this is what the breakdown looks like. So for instance, we went, in this example, we were looking at the United Healthcare. Health plan premium for 2 people is $614.99. Premium tax credit of $285 brings the monthly premium to $329.99. Add some dental in there, $28.20. And both are estimated effective dates of August 1st. So that's there. So it adds it up for you. You see the $329 plus the $28.20 gives you a total cost of $358.19, and that is with your tax credits. Now, I always press this button. It says, one last time, is someone helping you select the plan and enroll? Go ahead and click that just to confirm that you have your correct NPN number in there and that you are the agent or broker, and just hit save one more time. Alright, so there you go, and then you just go ahead and click confirm. And at the end of it here, it's going to give you some instructions on how to do your payments. Okay, so you've got United Healthcare. To activate your new coverage, you must pay your first month's premium by your plan's due date, which is going to be right here. So if they do not pay, no one gets paid. Your plan will contact you in the next few days with details on how to pay, or visit your health plan online to make your payment now. If your plan accepts online payments, your payment must be received and processed by the effective date to be fully enrolled. Contact the plan's customer service if you have any payment questions or issues. Don't send payment to the health insurance marketplace. This is important. Don't send payments to the health insurance marketplace. And then in this example, we have the dental also, which is separate. So, you've got a separate company with a separate customer service line with a separate premium and a separate effective date. I always jot down, remember that application ID number. So if the client is not ready to pay right this moment, then you can go ahead and give them customer service line, the amount that's due, when it's due, and their application ID number. I shoot and go straight for the sale because you don't want them to come back and say, oh, I forgot to pay my premium and I never got health insurance. So in this example, I'm going to show you how you can go ahead and how easy it is to pay for United, for instance. So you just click Pay for Health Plan. A new window pops up, and all you have to do is collect their information as far as payment goes. So you can go ahead and click Credit or Debit, type in the credit card number, expiration date, the amount, and then you click Pay Now. Or you can bill me later. Again, try to get them to pay now because you want to make sure that you're securing that customer for the effective date. Same thing here with Humana. You're going to have a separate customer service line and a separate website, so don't forget to do the dental if you added that also. There's separate instructions on how to do that as well. Okay? But that's it. Once you're done with the client, you can go ahead and go back in there. You can log out, and you've just done an Obamacare application. Congratulations. And this gives you an example of how easy it is to get it done. Okay? Any questions? Always call us. Thank you, guys.